is Kelly Hogan, and I'm a MAD student at Brock University. The topic of discussion for my Ignite presentation is life skills. Throughout this presentation, I hope that you will learn some effective techniques that can be used to achieve independent life skills. Life skills are important because they allow individuals to function as independently as possible. Learning life skills are especially important for individuals who have any physical impairments, ASD, or any other diagnosis that hinders them from performing daily skills independently. As a result, techniques such as task analyses, picture modeling, and video modeling has guided researchers to develop interventions to teach these life skills to allow individuals to access and navigate future environments successfully and independently. Researchers have focused on a variety of life skills using ABA practices. However, the most common skills entail cooking and cleaning, personal hygiene, finances, and engaging in activities within the community. Evidence-based research proves that skills necessary for independent life functioning should be taught in the environment in which the skills are performed. Therefore, domestic skills that correspond to a child's normal morning routine should be carried out in the home setting using a task analysis. Task analyses are created after observing the individual in the natural environment and by having parents complete a questionnaire to identify activities and tasks that are most important for instruction. Based on those results, target objectives are developed for the task analysis. The task analyses used in the study by Mayer and Cole ranged in length from 16 to 46 steps. Mayer and Cole measured baseline performance for each task by measuring the initial antecedent cue presented and the student's response to it. If the student did not respond to the cue, a physical prompt was delivered for that step. All steps completed independently were scored correctly. During instruction, the natural antecedent cues were presented. If the student responded independently within 10 seconds, verbal praise was delivered, and if they failed to respond, the instructor provided prompting or modeling. The results of the study revealed a significant increase in the levels of independence from baseline to treatment, and students became more independent in performing domestic tasks involved in their daily morning routine. Visual supports, such as photos and videos, are also proven to be effective tools for teaching life skills to individuals with ASD. Visual supports are an evidence-based practice used to help learners with daily routines and acquire new skills, making them more independent across a variety of environments. Picture prompts were created into a booklet which participants looked at the pictures on one page, engaged in the step, went back to look at the booklet, turned the page, and engaged in the next step until the skill sequence was completed. Researchers intervened only if participants made an error or needed a prompt. The percentage of correct responses, error correction prompts, and the percentage of prompts to use pictures was calculated. Praise statements were delivered to reinforce correct responding, and the intervention was terminated when criterion levels were met by students after completing 3 consecutive sessions with 85% correct responding. Although picture prompting strategies have been shown to be effective for teaching or prompting complex behaviors, many researchers have also investigated the efficiency and effectiveness of using video-based instructional materials to prompt responses. Video modeling differs from picture modeling as it shows a brief film for each step of the task analysis. Prior to conducting video modeling, it is important to measure expressive and receptive communication of participants through anecdotal and observational data collection. IOA was completed in this study by having 2 observers independently score data on whether the participant began the task within 5 seconds of viewing the video prompt and if the step was completed correctly. Data was used to determine the percentage of steps correct. A multiple probe across behaviors design demonstrated that use of the iPad was associated with immediate and significant gains in the percentage of steps completed correctly for each identified target task, and all 4 participants were able to maintain task acquisition without the use of video modeling. Although both picture and video modeling were shown as effective techniques for increasing skill level independence, participants generally preferred video modeling as they indicated that it was more fun and helpful. Thank you for listening to my Ignite presentation, and I hope that you have learned some appropriate steps and strategies to take when implementing a life skills intervention.